Is HbA1c a reliable tool? According to the RACGP Handbook for General Practice 2020, measuring glycated hemoglobin, or HbA1c, is one of the gold standard measures for diagnosing and monitoring blood glucose control. HbA1c measures the average glucose levels over the previous 2 to 3 months. The glucose accumulates on the hemoglobin as the red blood cells circulate. So any condition that affects red blood cell turnover will affect the accuracy of the HbA1c test. Any shortening in red blood cell lifespan will falsely lower HbA1c test results. So the HbA1c may be abnormally low in the following conditions. Anemia. This includes hemolytic anemia, including drug-induced, for example with dapsone or methyl-dopa, and hemoglobinopathies, which can occur in people of Mediterranean, African or South Asian heritage. It would be worth considering screening this group for hemoglobinopathies. Acute or chronic blood loss. After a blood transfusion or iron infusion, and chronic renal failure, where HbA1c may be variable. Abnormally high HbA1c can be caused by iron deficiency anemia, splenectomy, and alcoholism. Notably, during the first 4 weeks of pregnancy, the HbA1c test is an unreliable measure. When there is suspicion of HbA1c inaccuracy, asking your patient to check finger prick blood glucose levels is valuable. It would also be worth considering the use of flash continuous glucose monitoring, also known as flash CGM. An alternative, but less commonly used glycemic measure is a serum fructosamine level. This provides the average glucose level over the previous 2 to 3 weeks, but may not be suitable for everyone. For example, those with iron deficiency anemia or after an iron infusion. The approximate mapping between HbA1c values and estimated average glucose measurements is given by this equation. Overall, HbA1c is an important measure of glycemic management and should be checked every 3 to 6 months in people with diabetes. But if the HbA1c result does not correspond with the average finger prick glucose measurements, it's important to investigate.